Okay, hearing a diagnosis like anal adenocarcinoma can feel overwhelming, maybe even a little scary. We get it. That's exactly why we put this guide together, to help cut through all that confusing medical talk and give you a really clear understanding of what's going on. Our goal here is to give you and your family a solid foundation of knowledge, because that's always the best first step. So, we're going to walk through this together, step by step. First step, we'll break down what this diagnosis actually is. Then, we'll look at how doctors figure it out, what the go-to treatment options are, and finally, we'll talk a little bit about the long-term outlook. All right, so first things first, what in the world is anal adenocarcinoma? Let's break that term down so it makes a lot more sense. So, at its heart, an adenocarcinoma is just a cancer that starts in gland cells. The cells that make things like mucus. In this specific case, it begins in the tiny glands that line the anal canal. And that's what makes it different from the more common type of anal cancer, which is called squamous cell carcinoma. That one starts in the surface cells, kind of like skin. And to give you a little perspective, anal adenocarcinoma is actually one of the less common types of anal cancer. It makes up only about a fifth of all cases. Now, that distinction is really important because knowing it's this specific type helps your doctors choose the absolute best treatment plan for you. The cancer almost always starts in those mucus-making glands we just talked about. But sometimes it can also develop from something called a chronic fistula, which is basically an abnormal little tunnel in the tissue that's been inflamed for a long time. Knowing this, knowing where it starts, really helps to explain the kinds of symptoms people might experience. And because the cancer begins in these mucus glands, it makes sense that the common signs are things like feeling a lump or a mass, or noticing some mucus-like discharge. Now, these symptoms can easily be mistaken for other, more common issues, and that's why getting a precise diagnosis from your care team is so critical. So, how do your doctors actually confirm that this is what's going on? Let's take a look at the step-by-step process they'll follow. One of the very first challenges for the medical team is figuring out exactly where this thing started. Because the anal canal is right next door to the rectum, an anal adenocarcinoma can look a whole lot like a low rectal cancer. So a really careful, detailed examination is needed to tell them apart, since that decision determines the entire treatment path. Your diagnostic journey will follow a pretty clear path. It'll start with a physical exam, and then a biopsy, where they take a tiny tissue sample to look at under a microscope. And finally, you'll have staging scans, like a CT or an MRI, to see how big the tumor is and check if it is spread anywhere. This whole process basically creates a complete map for your doctors to work from. Okay, so once the cancer is diagnosed and staged, your care team gets to work creating a treatment plan that's made just for you. Let's look at the standard approach, which has been fine-tuned over years of research. Fortunately, there's a really clear evidence-based game plan. Study after study has shown that giving radiation and chemotherapy before doing surgery leads to better outcomes. This has become the proven, standard way to give patients the best possible chance at success. So the standard treatment is a powerful 1-2 punch. Phase 1 uses chemo and radiation to shrink the tumor and take care of any cancer cells hanging around nearby. This really sets the stage for Phase 2, the surgery, making it both safer and much more effective. Now, you're probably going to hear your doctors use a pretty long term, neoadjuvant chemoradiotherapy. It sounds complicated, I know, but all it means is treatment that happens before the main event. Just think of it like preparing the ground to make sure you get the best possible result from your surgery. After the chemo and radiation are done, the standard surgery is often something called an abdominoperineal resection, or APR for short. This is a major operation, and it's designed to completely remove the cancer by taking out the anus and rectum. Your surgeon will, of course, sit down and discuss all the details with you. It is perfectly normal to be wondering about the future. So let's talk about prognosis and survival rates. But it's incredibly important that we're clear on what these numbers really mean, and just as importantly, what they don't mean. Okay, so before we look at any numbers, please hold this thought close. Statistics are just averages from the past. They help doctors understand a disease in general, but they can't predict your individual story. Your journey is your own. You are not a statistic. So this chart, which is based on a study from a few years back, shows that historically the survival outcomes for anal adenocarcinoma have been different from other related cancers. A big part of that is because it's rare, which can sometimes lead to it being diagnosed at a later stage. But it is vital to remember that these are past statistics. Treatments are constantly getting better, and these numbers don't capture the huge impact of modern medicine.
So let's just recap the most important things to take away from all this. First, you have a specific, less common type of cancer. Second, it's treated differently than other kinds. Third, there's a clear, proven two-step treatment plan. And most importantly, your journey is yours alone, and the focus will always be on the care plan designed specifically for you.
Being an active partner in your own care is one of the most powerful things you can do, and asking questions is how you do it. Think of this as a starter list of important questions to take to your doctor. Getting these answers will help you feel more in control and make sure you understand every single step of your treatment. We really hope this guide has given you a clear, solid foundation to build on, because understanding your diagnosis, that is the first and most powerful step you can take toward facing your treatment with confidence.